Families dealing with loved ones with addiction, alcoholism, play a large role both in the active addiction itself as well as in recovery. There is a thought that it's the addict's problem, it's the alcoholic's problem, that they're the one who needs to go get fixed, deal with this, and come on back and everything's going to be okay. That is probably one of the greatest misconceptions about addiction treatment and the family's role in addiction as well as in addiction recovery. Families have been playing a part in it even without their own knowledge or even their own consent sometimes for years prior to the patient coming to treatment. So our philosophy is, if they've been a part of the problem, so to speak, and I don't say that in a judgmental or a shaming or a blaming way, just a participatory way, then we think it's very important for families to be a part of the solution. Recovery is really dependent on each individual. We see plenty of patients leave treatment here at Bradford, go into our outpatient services or into our continuing care programs or any of the other services that we offer, who didn't have family involvement. Maybe they don't have any family. And still be successful. But we do know that family involvement certainly increases the chances of a patient being successful in treatment, that is, transitioning to the next level of care. Addiction from the family standpoint as well as the patient standpoint is very isolatory. So patients come here, they find, wow, I'm not the only one. Families come here, they find out, wow, I'm not the only one. So the fellowship aspect, the education aspect about the disease, education about codependency, what those behaviors look like, kind of some key ideas to focus and be aware of in their life, such as enabling behaviors, rescuing behaviors, caretaking behaviors, so that if they're aware of that, then they have an opportunity to do something about it. If a patient is reluctant to seek treatment here at Bradford, we have an intervention service that we offer where a representative from Bradford can come and meet with the family, spend time with the family. With interventions, the family comes together, says, this is the way we're going to do things from this point on. The patient comes to treatment. If the family doesn't stick to that, well, then the patient is a lot less likely to stick to it as well. We have a 3-day family program at Bradford for all family members, close friends, significant members in the patient's lives. When I talk about family, I use that term somewhat in a broad sense, not just biology, but it's not uncommon to see a patient have a best friend for 20 years that is the most influential family in their life. So it's open to anybody who is going to be a significant source of strength or hope or support in that individual's recovery. Working with families, families seeking help, being a part of our 3-day program here at Bradford, taking advantage of our concerned persons group, family night at our outpatient locations, I think is absolutely vital to be a part of the healing process.